Well, thank you so much for having me here. So I practice general integrative small animal medicine in pretty much Los Angeles, California is kind of where I'm at. And I've gotten really interested in utilizing ozone with cancer cases. So I'm going to share some of my experience with ozone and oncology. So when we think about cancer, cancer treatments traditionally really haven't changed in the last, I would say, a few decades. The big categories in traditional treatments, we're typically thinking about surgery, chemotherapy, or radiations are the biggest categories. So within these traditional treatments, there are some limitations, right? With surgery, we're thinking about possible risks, complications. We're thinking about that animal's recovery from the surgeries. And sometimes there are some alterations of physical functions. If you think about potentially something like a splenectomy, we're removing a whole organ from the body system, and it is not without consequences. So surgery can have incredible, like fast results, but sometimes there are some limits and risks to think about. Chemotherapy is also another big category. There are always new developments in this category. The limitations there that I see is sometimes it's non-specific. The drug can target a variety of different areas. You can develop drug resistance with chemotherapy, especially with longer protocols. The tumor itself can become more and more resistant to chemo as time goes on. You can certainly get toxicity, right, from chemotherapy, because that is one of the major ways why chemotherapy works is that its cytotoxic effect on the cancer cells, but it may not select just for the cancer cells, so you could get systemic toxicity. And certainly I've seen with chemotherapy, there are sometimes concerns with side effects, quality of life issues while on the chemotherapy protocol. The third biggest category in traditional cancer treatment is radiation. So with radiation, a lot of times the biggest thing I see is the localized damage. Radiation is cumulative, so sometimes the effects can be worsened as the radiation treatment continues and goes on. It's rare, but occasionally you can see some secondary cancer due to the radiation effects. And because that there is a maximum dose that you can have with radiation, there's limited repeatability. You won't be able to keep doing something like radiation for long periods of time. And for me, when I'm looking at a cancer patient, I'm also a lot of times thinking about their journey and their emotional and psychological impact on both the animal itself and also the pet parents, because treating cancer patients can be quite a journey, and also the financial burden of things and thinking about all of those pieces. I think that we're all here because we are looking beyond traditional treatment, and I want to touch base on some of these novel approaches. So this slide, I love. Dr. Kendra Pope, who is an awesome integrative oncologist, had given me permission to share this slide from one of her really in-depth oncology courses. And this is one of my favorite slides when I am looking and thinking about cancer case. You can see in the middle here, there is that cancer, like tumor cell that's representative of a tumor cell, and then all the different ways that cancer can grow and expand and survive in the body. And then on the outer side, all the different ways that we can think about treating this cancer. I'm going to highlight some of the areas where ozone therapy can come in and help us start treating cancer. So you'll see that it can help over here with immune functions, so helping to improve the immune system to destroy the cancer you can see that also it can help to decrease the replicative ability of cancer cells. It can reduce inflammation and also help decrease that senescent ability of cancer cells. So in terms of mechanism of action, I've heard so much today of all the wonderful ways. So I'm just going to go with the biggest categories of what I think about when I'm trying to explain to um, pet owners like what we're trying to achieve with ozone therapy and cancer patients. So the first one is immune system modulation. So ozone therapy can really enhance the immune response against the cancer cells by stimulating the production of cytokines and other immune mediators. This immune modulation can help to create that systemic environment that is less conducive to cancer growth. So essentially making the cancer less likely to progress and also helping the immune system fight off existing tumors. The second one, which is improved oxygenation, this one I lean into a lot because I find that this is actually the easiest way for most people to understand how ozone works. Typically, I tell them like ozone is a trioxygen molecule, so it's O3, and our room oxygen is O2, so it has one oxygen molecule, and that extra oxygen molecule go into the body and helps to deliver extra oxygen. I find that to just be the most simple way for people to wrap their mind around ozone and understanding it. For us, we know that with ozone therapy, we are improving oxygen delivery at the cellular level, and ozone therapy may also inhibit the growth of cancer cells that typically like the more hypoxic environment, so low oxygen environment. So enhancing that oxygenation can support more normal cell metabolism and a more healthy environment, making cancer cells less likely to be able to thrive. We can also use ozone therapy to help detoxify and reduce side effects of any traditional therapy that the pet may be going through. So ozone therapy has been shown to help detoxify the body and mitigate some of the adverse side effects that are associated with traditional treatments like chemo and radiation. This includes like reducing inflammation, promoting healing of the damaged tissue, and possibly reducing the severity of side effects like nausea, fatigue, and other common side effects that you might see. And the last category that I like to talk about is its direct anti-cancer effects, because we are starting to see more and more studies suggesting that ozone therapy can directly have cytotoxic effects on cancer cells or sensitize them to the effects of chemo or radiation, typically by inducing oxidative stress and selectively in cancer cells. So ozone can trigger apoptosis or making cancer cells more vulnerable to other treatments, which can be powerful if they're going through some traditional therapy as well. I'm going to bring up a couple articles that I find to be helpful in understanding some of how ozone works with cancer, but not spending a whole lot of time here. It's for your information if you're interested. This one I really like. This just came out pretty new, 2024. I find it to be a really good article, just high level, kind of goes through mechanisms of how ozone can help in cancer treatment. This one specifically is in human breast cancer treatment. So, but I'm a big diagram girl, so this helps me, like having the little diagram and where ozone goes and how it converts and what pathways and enzyme is affecting. So this is a great introduction to how, if you're looking at mechanisms and how ozone affects it. I really like it for that. This one I find interesting because a lot of my cancer patients, not only I find that a lot of my patients come to me because they want quality of life. Certainly the family's biggest hope is that we can extend the quantity of life, having them live as long as possible. but all of them want their pet to have as best of a quality of life as possible. So for me, being able to use ozone therapy is a great way to reduce any side effects that they may be encountering in other treatments, or just support them in their journey if they are really compromised from their cancer condition. So this is a great paper to show that it can be very supportive in more palliative therapy. And this paper is the one that kind of also points to, I think Dr. Joaquin earlier also mentioned that one of the really cool things that we're seeing is that ozone can target cancer cell with cytotoxic effects, but sparing normal cells, which is really cool for me, because when we use modalities like chemo or radiation, a lot of times you can't mitigate the effects that you have on the normal cells. So being able to have that power to selectively affect just cancer cells and not the normal cells is pretty powerful. So I want to go into talking a little bit about how I use ozone therapy on everyday kind of clinical applications. So we've talked a lot about the techniques. So you're very familiar with some of the systemic and local ways. So systemically, I'll use rectal insufflation, I'll use minor autohemotherapy, major whole hemotherapy, and O3 UV. And locally, I'll use direct injection, topical, and lymph backing. And we'll go into a little more of these. So the first thing before we start, though, it's really, really important if you're integrating ozone therapy to think about what other therapy this animal is going through. So if we're thinking about traditional approaches to cancer and your pet may be going through some of these treatments, it's important to think about how it integrates. So if the pet is concurrently receiving chemotherapy, the integration, you may want to think about incorporating ozone therapy by potentially enhancing the sensitivity of cancer cells to the chemotherapy agents. You can do it by improving the oxygenation, stimulating the immune system, and it can help to mitigate some of the chemotherapy side effects. It is really, really important to understand if that animal is actively going through chemotherapy, what drugs are being used, mechanism of action, so that you choose the most appropriate modality and communicate to the oncologist that's actively managing the case. I think it's really crucial to make sure this pet is being monitored closely for blood cell counts, liver and kidney functions, and its overall health status, so that we can help to manage any unexpected reactions. Generally, if a pet is on chemotherapy, I am really, really cautious if they have blood disturbances like severe anemia, neutropenia, thrombocytopenia, or bleeding tumors. Not that you cannot use ozone therapy. You maybe need to lean into more conservative ways or being a little bit more careful about your dosing. And definitely a caution with O3 UV during chemotherapy. If the pet is going through radiation, radiation works on killing cancer cells by oxidative stress. So we know that hypoxic cancer cells are more resistant to radiation therapy. So by introducing ozone, we can actually help to increase the oxygenation, and that can enhance the effects of the radiation therapy. We will want to monitor for signs of radiation toxicity or worsening of symptoms. It should be carefully timed so that it's not interfering with the radiation treatment schedule. And you want to avoid direct ozone application in areas that's recently exposed to radiation, or being careful not to apply to tissues that are currently planned for radiation treatments. And generally speaking, I don't do O3 UV or UVBI during the active radiation treatment. And that's more because I think that they're already going through a big kind of oxidative stress period to not overwhelm their system. So I'm generally really careful. I find most radiation oncologists are also pretty careful when they're doing the treatments to not have anything else interfere with the results. So generally, while they're going through active radiation, I just stay away from this. If an animal is going through surgery, post-surgically, ozone therapy can be used to help with wound healing. We've seen a lot of amazing cases today of how that could help. It can help reduce the risk of infection, improve tissue oxygenation, and then help with a faster recovery. We will want to closely observe for signs of infection, poor wound healing, or any adverse reaction to ozone therapy in the surgical site. Not a lot of big contraindication in my mind for surgery, but just being careful of managing surgical wounds. If you are very comfortable with it, I think there's no issues. With patients that may have delayed or poor wound healing, just make sure that you're being careful. If any pet is on blood, like medications that can affect blood clotting, you also want to be careful. But generally, no big contraindications as long as the pet is a suitable candidate otherwise. So when I'm doing ozone therapy for my cancer patients, these are kind of the steps that I go through. One is selecting the right patients and then coming up with the protocols, keeping my safety and any side effects, and then just making sure that we're all covered on the legal and ethical consideration for these pets. So I'll go through them in a little bit more detail. So I think patient selection is really, really important. Being able to select for the right patient for ozone therapy and evaluate benefits versus risks, and being able to have that really good conversation with the family and the owners and coming up together. I think one of the most important conversation to have with any pet owners with the pet going through the cancer is to really understand what their goals are, because the animal can be in different stages. The owner can also have different expectations, and just being able to come together and understand if the expectations are realistic and what they're trying to achieve. I find that most of them first and foremost care about quality of life issues, and then from there you can develop, based on the pet that you're looking at, what is the most appropriate steps to take. So on our end as a doctor, our decision should always be overall health, the condition that's being treated, as cancers it's a pretty wide ranging disease state, so there are a lot of sort of tailoring to each individual patient, and then just understand any contraindications that you may have. So for condition suitability, you'll want to make sure that that patient with the condition can be responsive to ozone therapy, like chronic infections, inflammatory conditions, different types of cancers, and wound healing issues, and just making sure this pet is suitable for ozone therapy. You'll want to make sure you've done a thorough evaluation of that patient's general health, including organ functions, its hematology, parameters, to make sure that they can withstand the oxidative stress induced by ozone therapy and they will be safe during the treatment. It will be important to just understand that patient's history of any conventional treatments, as we've just looked at a couple slides ago, like if they're going through very specific chemotherapy protocol, radiation protocol, you will want to be careful in what you're doing on the ozone. And just understanding how ozone therapy can help offer that complementary benefit. And it's really important to keep in mind that every pet's tolerance can be a little different as well, even if you're using this protocol for this animal and they do really well, it doesn't always mean the next animal could do really well. So it is really important to understand both their physical tolerance and their psychological tolerance. I have pets that don't do well with certain modalities. Some pets really hate rectal insufflation, but it's fine with sub-Q injection and vice versa. So understanding how often they're getting the treatment, how they tolerate it, if they're being stressed out, I think it's really important because that goes into their quality of life. I want all my cancer patients to have at least like as little stress as possible. And then just making sure you have the owner's informed consent, understanding what you're trying to achieve with what method, and get a signed treatment plan and consent. So these are some big picture protocols that I use for my cancer patients based on my experience, just keeping in mind every patient's different, so you will want to evaluate them individually. So rectal insufflation.
Dr. Chen, I don't think your presentation is showing.
Oh, right not now. At all.
No, I think it must have stopped share. Just restart share.
I had like a weird screech and then something happened. Okay. It's okay. Let me see. Where did it stop?
Oh, you can just start from where you're at. I'm not entirely sure. Yes, I do see your screen now, so you can just show your presentation up and
okay. Can you see it?
Great. Yep.
All right. Okay, so we are at protocols with rectal insufflation. So concentration, typically 25 to 35. Volume, I usually use about 1 ml per pound with a minimum of 10 cc. Generally speaking, in my experience, if they're coming into the clinic, the most I can do is maybe twice a week. Most pets are coming in once a week, only because of availability. It is very hard to get people to come in more than twice a week. I have had a handful of pet parents that are able to get a machine at home and they are willing to do rectal insufflation at home, and in which case you can use it every day, sometimes even a few times a day, just depending on that pet and what your goals are. But rectal insufflation, I find, is the most gentle and effective way to start introducing ozone therapy. I have had some really powerful success with even just doing rectal insufflation. I've had a patient with a really big colon mass to the point that that pet could not defecate anymore, even with a ton of stool softener, and was told there were no more options and they needed to euthanize. And we started doing rectal insufflation. Within a week or two, he was starting to defecate. And now we are more than a year out since that day where he was told that there were no other options and they needed to euthanize, and came to us for a second opinion. So I think that it could be really, really powerful. Minor autohemotherapy, I usually am using 25 to 35 microgram per mil and volume about 0.5 to 2. Plus the ozone injected IM. I will also use this in my acupuncture points. If you do practice acupuncture, I find it is really powerful to be able to combine that, or using it locally around the tumor. Typically, I do this up to once per week if I'm treating with minor. So if my pet's like, I typically will always start with rectal, maybe introduce a minor before I move on to like major or O3 UV, just to make sure the pet is tolerating ozone therapy. If I am doing major autohemotherapy, I like to start my dose really low and be really, really careful with weaker animals because they may be overwhelmed if you go too high, and that can overwhelm their your antioxidant system because you're introducing so much oxidative stress. So start low. You can always work yourself up. I have used pretty high doses and got really good results, but I would work up to those doses. The volume that I use is about 2 ml per 10 pound of the blood, and then use twice the amount of that ozone with gentle mixing. Typically, I will start about once a week for a few sessions and see how things go first. Direct ozone injection is one of my favorite ways to treat my cancer patients. There are a lot of different ways to utilize these. Sub-Q ozonated saline, 25 to 35 microgram per ml, 1 to 10 ml per pound, 1 to 3 times per week. As sub-Q infusion, I love using. Animals generally tolerate this really, really well. I will also put them in my acupuncture points. And ozone gas injection. So I like using this for, those solid tumors. You can inject it around the tumor, into the tumor, intraperitoneal. As Dr. Roman had talked about this morning, I do think the dose I put down is 10 to 15, mostly because anything over 15, we do think it will burn and make that animal really uncomfortable. However, I do think that higher concentration can be considered because of its direct cytotoxic effect. So for those cases, consider maybe sedation or even anesthesia so that you can get really high doses if that's what you want, is to kill those cancer cells directly with the gas injection. For bladder tumors, I have used infusion of ozonated saline or gas. So urinary catheter is preferred, but sometimes you have female pets that are really difficult to catheterize. So I have also tried cystocentesis with good results. So typically I would sedate them or at least give them something so that they are relaxed. The dose I use also, I will start low, but 15 is 10 to 15, my starting dose. I have worked all the way up to about 35, and I do think that you could potentially go higher, but it's really need to be evaluated for that case. Once a week or bi-weekly, and then evaluate as you go based on what your goals are. For O3 UV, it's a pretty wide range of dose because I do think that it's very case specific and how strong that animal, what stage of disease. My general advice would be to start low. If you can and you have the time to kind of work up to higher doses. Some of the times where I do start out with higher doses is because I don't have the time to wait. It may be that the disease is advancing so quickly, and I would have that conversation with the owner and then decide what the risk tolerance is. But if I can, I will start low, and I'm really careful with my weaker animals. And we've seen the protocol for this a lot. I generally use 2 ml per 10 pound, mix it with saline plus ozone, run it through the UV. About once a week is where I would get started. Usually I would do 2 to 4 sessions, come back, and then reevaluate. Common cancer strategies for patients, based on my experience, is that first, I will always want to determine what is the goal of the treatment. Are we trying to do cytotoxic treatment? We are actually actively trying to make the cancer reduce or go away or go into remission, or are we in a phase where we're doing supportive and quality of life treatment? Sometimes that can really influence how we choose our modalities. We'll want to consider the patient health status, stress level, and owner wishes. You'll want to consider any other concurrent treatment that the pet is receiving, identify any contraindications, decide on your treatment plan. If you can, start with a more conservative and lower doses and then gradually work it up. And you use your monitoring parameters. Make sure you are constantly checking your animals to see how they are reacting to your treatment, and then be able to also determine if your treatments are effective and adjust as needed. I think it's also important to make sure that you're considering the safety and side effects and being able to minimize any risks and adverse reactions. Generally speaking, my experience has been ozone therapy has been really, really safe for me. It's very, very rare that I see adverse reactions. But it is always important to have that at the back of our minds. So safety first, just making sure your team and everybody who is involved in administering the ozone are adequately trained. They are using, or we're using, good, good equipment and delivery system that can allow for the accurate dosing for the protocol that you're wanting to use, and making sure that you're doing it in a well ventilated space. You want to double check your patient status and the dose of treatment every single time. Because I know that sometimes it's easy to repeat like, oh, the same thing from last time. But sometimes things can change, and it is really important every single time you're double checking it and you're monitoring, doing regular follow-ups, go slow and start low. And then generally really rare as far as adverse reactions are concerned. If they do occur, treat symptomatically. Some legal and ethical considerations when we do ozone therapy, especially for cancer patients, mostly because a lot of these cases come and they have seen multiple specialists, or maybe you're working with an oncologist. So you just want to make sure that you are also protecting yourself. So just regulatory status within your state, making sure checking with the veterinary medical boards, OSHA regulations, legal restrictions, your drug and medical device regulations. Currently, as far as I'm aware, we don't have a lot of heavy restrictions being placed on us. We're starting to see it more on the human side of things in certain states. So I think that it's just important to just know that it's there and being updated and being careful with those. Professional guidelines, of course, best practice guidelines, make sure you've had adequate training and certifications. Do no harm is the first principle when we treat our patients, and then making sure that you're getting informed consent. And for me, I think some of our own responsibility is that we stay informed, keeping up with updates, educate the pet owners, provide as much information as possible, evidence informed, discuss best practices, and then, come to conferences like this so that we can collaborate, learn from each other, share our experiences, and all kind of grow and do better in terms of getting better clinical outcomes. I would love, 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 love to see that we can get this out in the world a little more. If I have more time, I'd love to show some cases, but I've had incredible results with cancer cases when I started incorporating ozone. I do think that the current challenges and limitations is the ability to be able to push forth with more scientific-based research. So I think we can all work towards doing more of that, and also educating as many people as possible about these alternative treatments to cancer, and being able to know that if you remember from like that very first slide, that besides the conventional therapy, we have this whole world of integrative therapy that can be really, really powerful. Because at the end of the day, all we're really working towards is to improve the outcome and the quality of life of our cancer patients. And that's it. Thank you so much. Let me know if you have any questions, and I'll do my best to answer them.
Awesome. Okay, you can hear me?
I can hear you.
Excellent. Thank you. So we do have questions, and we do have about 10 minutes before our final panel discussion. So guys, stick around for that. In about 10 minutes, we're going to start the panel discussion, or actually we have couple minutes of break, and then we're going to start our panel discussion. I have a few questions for the panelists, and then we're going to answer your questions as well. But for you, Dr. Chen, right now, first question is, do you do rectal ozone chemo, direct injection, and autohemotherapy, or O3UV all at the same time?
All at the same time. I have combined a few things together, meaning that I would do like a rectal ozone insufflation plus sub-Q, ozonated saline, and do like an acupuncture point. I have also done, if I do a major, it's very like, usually I will save a little bit to do minor.
Yeah.
But yeah, I would combine therapy all the time. It just depends on like the case in front of you, how much you think that pet could tolerate, and what benefit are you trying to get if you're combining therapies.
Yeah. So definitely maybe a couple different administration methods, but not necessarily everything every day.
Everything every day. I would love if like everybody every day got like rectal insufflation. It's
Yeah.
just not super practical, but
Yeah. Okay, good. So next question from Dr. Caputo is, can I do high dose vitamin C therapy on the same day as rectal ozone? Is it better to separate the two therapies?
this is very interesting. Because depending on your dose of IV vitamin C, so the true high dose IV vitamin C, and just know the protocol out there, and just depending on what you're using, is not true high dose IV vitamin C. So IV vitamin C in like the moderate doses are still antioxidant. Really high doses of IV vitamin C is true oxidant. So traditionally people have not mixed IV vitamin C with ozone therapy because they think one is antioxidant, the other one is an oxidant. So if you're using true high dose IV vitamin C, then you can use ozone with it. And I have done ozone rectal insufflation with my IV vitamin C cases. I wouldn't run them like together while the animal is getting, the vitamin C, but on the same day, I think it's fine. Again, it depends on your dose, and if you're on the oxidant side of things, I think that's okay. If you're on the antioxidant side of things, you just want to think about like the timing so that you're not mixing them together in the same time frame.
Yeah. Good. And that question comes up every single summit, I think. This is a super common question because I think there's a variety of opinions and thoughts out there. But I think you had a good answer. We just tend to recommend, maybe doing your ozone therapy and then doing your IV vitamin C afterwards. And it doesn't seem like you need to separate them by much time.
I don't think so. I just would also ask if we're doing it together. I mean, unless to me, the reason that you're doing it together on the same day is probably because owners' availability, like I
Right.
can only come, right? Because in a perfect world, we would just run them on different days.
Yeah.
Yeah.
Yep. That tends to be the issue, I think. Okay. Can you expound a little bit on major autohemotherapy as a cancer protocol in animals? I'm interested in that. So pretty general question, I guess.
I know.
But
Like we could talk for a little while.
yeah.
Yeah. Major. Is there a more specific way? I guess I use major. I can answer it this way. I tend to lean into doing major autohemotherapy in pets that have more of I think of it as more like diffuse tumor, so like lymphoma cases. I do lean into that a little bit more. Like if you wanted to have a more widespread systemic effects. Hope that
Yeah.
helps.
Yeah. Yeah. So, I mean, if you're using O3UV, they're both considered, non-specific treatments that help induce the body to function more efficiently to eradicate cancer cells and to allow the immune system to function more effectively. And so, the benefit, I guess, if you're doing the blood ozone major out of hemotherapy, is to maybe add the UV to that, which you wouldn't get that benefit if you were just doing rectal insufflation.
Mhm.
But do you use antihistamine to pre-sedate when injecting mast cell tumor? Is the next question.
Yes, I do. Anytime I'm touching mast cell tumor for any reason, if I know it's a mast cell tumor, I give them Benadryl.
Okay.
Yeah, absolutely.
When you inject directly into the tumor, isn't there a risk for spillage? That's a question.
Spillage as in like outside of the tumor itself, or
Yeah,
or
isn't messing with the tumor, maybe, I guess the question, isn't that maybe a
like you
risk?
are because the way I see it, I think if you're concerned about like activating it more or something like that,
Okay.
because if our goal is to use a cytotoxic dose, and that's why when I talked about the direct injection, if I use a lower dose, so if we're staying below 15 microgram per mil because we don't want to cause that sting or burn, I am usually kind of around it and not into the tumor because I don't think I'm at a cytotoxic dose. So if I'm really the only time I'm injecting it directly into the tumor, I'm using really high dose. Like I want it to be cytotoxic. So that animal is probably usually sedated or not feeling it so that I can just get that dose. And in that case, I am not as concerned about spillage or activating the tumor more because I am using such a high dose that it should be killing the cancer cells.
Okay. And then another question here. Oh, let's see, where did it go? What side effects have you seen? Have you linked those?
So yeah, typically the cases that I have seen are usually the OCUV, and I think it is because we are really still trying to understand, at least for me, what dose is appropriate and being able to think about everything that's going on. I think it can be really, really complicated to know what that animal is going through in terms of all the pathways it's going through the system. So usually when I get side effects, I think that I've used too high of a dose and it's overwhelming their antioxidant system. Typically, like they can get really lethargic and not feel well. I've had patients breathe really fast after the treatment. All of them have been self-limiting, and it typically lasts like sometimes just minutes, or a day or so. I have not had severe side effects where it's more serious than that. But almost all of them, I would say, are when I run O3UV, and I do think that we collectively, hopefully in the future, will have a better understanding of what would be a more appropriate kind of protocol and dosing. Although I still think that a lot of it is animal dependent, and we do our best to understand what's going on in the system. But there's some things that I just can't see or know ahead of time.
Yeah. How many? I don't know if you'll be able to answer this very clearly or not, but how many cases have you had experience in which you've witnessed a decrease in cancer cells or regression of cancer in this use? So can you put any sort of percentage on that or any
regression percentage?
It's a tough question. Like
I
right
want
off the
to
top of
say
your head.
almost all of them, I can say with confidence, if I didn't use ozone therapy, they would progress much faster. Is that a reasonable answer? It'd be like 100%. They all do better when I feel when I can incorporate some form of ozone therapy than when I was practicing without it. Like I don't think that there have been cases where I've introduced it in some form way or another that I felt like made no difference for that cancer patient.
Awesome. Just a couple more. Do you do MAHT on the same day as chemo?
Do I use MHD on the same day as chemo? No.
Okay.
Generally speaking, I try to really stagger treatments. If they're getting chemo that day, that is typically not the day that I want to add another concurrent treatment.
Okay. Okay, great. So I don't know if you said this or if this was somebody else said that you said sometimes you have owners give rectal ozone more than once a day. Is that true?
Um, is it
And
true?
what's the
No,
maximum?
and this is what I just learned this morning from somebody's lecture. I think it was Dr. Joaquin's lecture,
Okay.
where there's a human patient, and then he was giving himself rectal ozone 2 to 3 times a day
Mm,
for his brain tumor. So I just found that protocol interesting. Have
mm,
I recommended it? No. I mean the most I would go is once a day. But I
mm.
think in very late stage cancer patients, if I have another appropriate cancer patient and it's appropriate, I would not hesitate to try.